This is part of our series, President and Civil Rights. We've been discussing Ronald Reagan, and we've been doing a special series within a series, right? To address Reagan's response, or lack of, to the AIDS HIV epidemic. Yesterday, we started with the beginning of the epidemic. Today, let's talk about Reagan, his administration, and their response, or lack of, to the AIDS HIV epidemic. Okay. It's important to note that before joining the Reagan administration, White House Communications Director Pat Buchanan disparaged people with AIDS during the onset of the epidemic. Buchanan regarded the disease as moral punishment for the poor homosexuals who have declared war on nature, and now nature is exacting an awful retribution. And that was Pat Buchanan, everybody. So the silent stance on the AIDS epidemic allowed Reagan to maintain his political support by neglecting the deadly issue facing the gay community. While Reagan maintained his silence, his administration silenced other officials who attempted to properly address the AIDS epidemic. Addressing national epidemics is routine. For surgeons general, however, the Reagan administration deliberately silenced Dr. C. Everett Koop and his team of public health professionals when it came to the AIDS epidemic. Dr. Koop explained that a large portion of the president's constituency was anti-gay, anti-recreational medicinal abuse, anti-promiscuity, and anti-sex education. Who would not respond well to some of the things that would have been said in a health report on AIDS? The homophobic ideology dictated the Reagan administration to concentrate on maintaining its constituency, which included avoiding a public health crisis that would deter public support. Because I guess that's the priority, not human lives. Okay. The Surgeon General under Reagan, Dr. C. Everett Koop, this is one of his accounts. But for an astonishing 5.5 years, I was completely cut off from AIDS. I was told by the Assistant Secretary for Health, my immediate boss, that I would not be assigned to cover AIDS. The department took its cue from him. Even though the CDC commissioned the first AIDS task force as early as June 1981, I, as Surgeon General, was not allowed to speak about AIDS publicly until the second Reagan term. Whenever I spoke on a health issue at a press conference or on a network morning TV show, the government public affairs people told the media in advance that I would not answer questions on AIDS and that I was not to be asked any questions on the subject. In an interview, a 2006 interview, Margaret Heckler, who was Reagan's Secretary of Health and Human Services from 1983 to 1985, stated that she had never gotten the chance to speak with Reagan about AIDS, as the Reagan administration's cabinet meetings were highly structured and AIDS had never been put on the agenda. Tomorrow, we start with a conversation about the AIDS HIV epidemic between Reagan's press secretary and a reporter. You'll find it very interesting.